This is the case of patent ductus arteriosus. In this image, how to identify PDA. On 2D image, you see the A for aorta, M for main pulmonary artery. This is right pulmonary artery. This is left pulmonary artery, and this is patent ductus arteriosus. If you go from rightmost to left, the rightmost structure is right pulmonary artery, then left pulmonary artery, and final one or last one, or you can say the most lateral one, is the PDA. This is main pulmonary artery. Main pulmonary artery are giving 3 branches. In that case, third one from right side, third one should be patent ductus arteriosus. So the PDA always most lateral structure, even left to left pulmonary artery branches. Just you have to remember, left to left pulmonary artery branches is PDA. When the PDA is small, you can find out it by color Doppler, but when the PDA is very large, in that case you have to be very confident of the anatomical criteria to find out PDA. Same thing, again you see the same thing. This is right pulmonary artery, this is left pulmonary artery, and this is PDA. So that is PDA. Again you see, PDA is very clear in this image. You can see this is PDA. No doubt this is PDA. This is left pulmonary artery, and this is PDA. Clear cut finding. You can say clear cut finding of PDA, how the PDA is communicating with aorta. Obviously thoracic aorta. So this is left pulmonary artery. Occasionally right pulmonary artery also comes into view. This is the portion where right pulmonary artery, you can see intermittently right pulmonary artery or right pulmonary artery. So this is how. This is not exactly parasternal short axis view. This is parasternal long axis view, modified long axis view. So you see the better, more portion of patent ductus arteriosus in this view. Again the same thing. The size of PDA at aortic end and pulmonary end. Now see the color flow of PDA. This is left pulmonary artery, and this is PDA. Clearly see the flow is left to right. Flow is from aorta into pulmonary vein. Pulmonary artery. So from aorta to pulmonary artery, that is PDA, and flow has left to right, that is from aorta to pulmonary artery. You can clearly see this is not parasternal short axis view, this is parasternal long axis view, right ventricular outlet view. So image wise, I want to show image. This is right ventricle. This is right ventricle outlet portion, and this is pulmonary valve, and this is main pulmonary artery. This is MPA, main pulmonary artery, or pulmonary trunk you say. Now you see, this is not parasternal short axis view, this is parasternal long axis view, that is right ventricular outlet view. Very small. This is left atrium, this is left atrium, and this is left ventricle. So this is right ventricle, this is interventricular septum. This is interventricular septum, this is right ventricle, this is main pulmonary artery, and this is PDA, this is left pulmonary artery. So this is long axis view, right ventricular outlet view. Again you find the same thing, image is quite clear, you can easily understand. So PDA is always left to left pulmonary artery branch. This is parasternal long axis view, right ventricular outlet view. This is parasternal short axis view. You can see intermittently PDA is coming into view. So you have to go a little bit higher, that is more cranial compared to normal image, then you will get PDA. It will be more cranial. Again you see the parasternal short axis view, location of PDA. And this view, left pulmonary artery comes very less in the image. So this is R for right pulmonary artery branch, L for left pulmonary artery branch, and P for PDA. LV chamber is D-shaped, indicating raised pressure. This is the pressure across tricuspid valve, and that is 38 mm of mercury. That means it is a right atrium, right ventricle enlarged. This is the ASD of 3 mm. Again the ASD flow across ASD, red in color. Same TRZ. Again you see the PDA in this image. So this is the case of patent ductus arteriosus along with raised right ventricular systolic pressure with a small ostium secundum ASD. PDA is here a significant one. Only thing I want to highlight, how to know the location of PDA. When the PDA is very large, anatomy will help you to identify the PDA. When the PDA is very small, even color Doppler can give you the correct diagnosis. When the size is small, turbulence of flow is quite high, and that cannot be missed on color Doppler. But when the PDA is large one, flow across, that can be have less velocity, so cannot be detected easily on color flow. When the gradient across the PDA is very less or zero, if gradient is zero, there will be no flow. If gradient is less, then less velocity flow, and less velocity flow can be missed. In that case, you have to know how to identify PDA on anatomical basis or 2D basis. Thank you.